Hi, my name is Cucu Saidah from Indonesia. Currently, I work as Disability Inclusion Advisor in CBM Indonesia. I joined CBM back in October 2018 as a full-time staff, a month after the earthquake hit central Sulawesi. At that time, CBM Country Office of Indonesia was a new beginning in humanitarian response. But then since November 2019, I work part-time. My role in CBM is to support inclusion of persons with disabilities by providing disability inclusion advice and capacity building to external partners and active involvement in disability advocacy agenda. As a person living with disability, I have a dream to see accessible future where persons with disabilities enjoy their life wherever they are and whatever they do are independent. In Indonesia, unfortunately, and almost everywhere in the world, persons with disabilities are in the most at risk leaving behind. Attitudes, system, information, and physical barriers are still exist. Those barriers are makes persons with disabilities hardly to get their rights, even for their basic rights such as food, education, health, and identity card. This makes persons with disabilities are living in poor and under poverty cycle in their whole life. I choose to work in CBM as a way for me to reach the dream. That is to remove all barriers to access, together with disability movement, asking and reminding development organizations, society, government, media, and donors to ensure persons with disabilities are not left behind. In the work of development and humanitarian response, I learned a lot of lessons. An example from Central Sulawesi, where I was involved in CBM earthquake emergency response, lobbying and training to mainstream actors were not that easy. However, slowly and step by step, mainstream actors are beginning to include persons with disabilities in their program design and delivery, and of course address barriers to accessibility. I think this is a good sign where ensuring inclusion of persons with disabilities really need willingness from different stakeholders in all aspects. In regard to current situation of COVID-19, this could be adding barriers for persons with disabilities. Physical distancing, social economic activity restrictions may have significant impact to the life of persons with disabilities and their families. For example, findings from the rapid impacts assessment we had, economic is the most significant. Many of people with disabilities, they lose their income. Then there are risks of discrimination to access health service because of inaccessibility and attitudes toward persons with disabilities. So people, let's keep up our work collaboratively and help me to reach my dream. Thank you.